Okay, everybody, I've just gone ahead and started recording this session. So an official welcome to our two esteemed guests, MLA Doug Clovechok and MP Rob Morrison. We have currently about 36 attendees on the call as well. And it looks like some people are already familiar with the Zoom way of doing these things. So if you are not, you'll see attendees that there is a box at the bottom for Q&A. The way the Q&A works on these webinar versions is type your questions in there. We do ask that you put your name in the question so that if we have a follow-up or if we need to ask a question, it's not an anonymous question. If you see that somebody else is asking a question that you were going to ask as well, you can thumbs up the question and it will rank that question higher up so that if more people want to know about certain things, it'll kind of help prioritize things that way as well. We did have some formal introductions here for both MP Morrison and MLA Clovechok. Gentlemen, would you mind if we maximize the use of our time together and just kind of dive right into the meeting?
Absolutely, absolutely.
Okay, yep. Perfect. So before we get into any questions, MP Morrison, would you care to lead us off here? And I do have that document you provided me, so if you need me to screen share that at any time, I certainly can. But if you're just happy to run down maybe some of the big stuff that's updated even in the last few days from the federal perspective, and any other things that you'd like to share would be fantastic. So thank you.
First of all, thanks, Peter, for getting us together on this, and I look forward to the questions as they come in. As you know, things are changing daily with the federal government, so we are trying to keep our websites up to date, and we do go to canada.ca for helping people. We probably are getting between 50 and 200, 300 calls a day. Now shifting from trying to get people home who are away to now getting some financial support, underserved, and more recently, our business communities are becoming much more vocal in trying to understand when we can start looking at an economic recovery. I do want to say that I want to congratulate all the people, Kootenay, Columbia, who are listening to the provincial health minister and a provincial health officer on stopping the spread of COVID, and we really are doing a great job. There is an announcement this morning, I believe. I don't think it's come out yet on what the province is going to do and regroup with their modeling that they started out with. So I look forward to that. I am working on a strategy for economic recovery, but I just want to ensure people know that we are not opening the doors for full business, but it's time that we start thinking about where we're going to be moving forward to, especially in support of our small businesses who are hurting financially and having to lay people off. And I also want to say that we've been working hard on trying to keep the government accountable on some of the programs they've come out with, like CERB took a long time. CEBA for the businesses is still not really flowing well. We were fortunate to get 75% of the funding for the salaries through, which was a bit of a fight. So we are holding the government accountable as best we can. It is very difficult in a world where we can't sit in Parliament to ask those questions that need to be asked, and it makes it difficult. But I don't want to talk too long because I really want to hear what the questions are and help everybody through there. But thank you so much for having me here today.
Fantastic. Thank you very much, Rob. And Doug, over to you.
Well, thanks. I'm just going to share this little bit of a presentation. I'm trying. Okay, there. That should be up there. Everybody see that? Okay.
Yeah, got it now. Thank you.
All right. Just to start off, I just want to say that and recognize that we're all meeting today on the traditional shared territories of the Shuswap and Tunuka people. And that I'd like also to reflect and what Rob just said about the work that's being done by people here in Columbia River, Revelstoke, and of course Columbia Kootenay. I was on a call yesterday with Dr. Bonnie Henry for about an hour and 45 minutes, and going through graphs and presentations. We are doing outstanding in the province of British Columbia. The only people that are actually beating BC in terms of flattening this curve is South Korea and Australia, and they've implemented severe measures to do that. So congratulations to everybody. What you're doing is working, and just keep on doing that. And just to put things into context a little bit, in terms of how dire this really is that in March alone in British Columbia, we've lost about 132,000 jobs. And they're projecting at least another 100,000 in April. And just to put that into context, during the 2002-2009 economic downturn, a total was lost plus or minus about 60,000. So definitely this is unprecedented. We've never seen anything quite like this before. So in terms of economic recovery, there's tons of modeling that's going on, but it's so difficult to predict in terms of how long this is going to last. And I know that Rob will agree with me. The only way that this is really going to end is with a vaccine, and that's months out. So just kind of moving into some slides. And for those of you who are watching, you can get this slide presentation from Peter. He'll email it to you. And as we go through it, you're going to be able to see some links. And when you get this, you'll be able to log on to the hyperlink, and you'll get the exact website that I'm talking about in terms of each of the programs. So to date, $5 billion from provincial government and financial aid, and it kind of says that. You guys can all read that. Business supports, I just want to go through very quickly from a provincial perspective. There's the employer's health tax, which has been deferred till the 30th of September. Sales tax, provincially, municipally, and regionally. Carbon tax, motor fuel tax, tobacco tax, Netflix and sugar taxes have been deferred. There's been a reduction in school taxes, the deferral of Work BC payments and their deadlines. And hydro, you can actually, if your business has been affected by COVID-19, you can get up to three months relief on that. Now, keeping in mind, you're going to have to pay for that eventually anyway. So on to the next slide. Business supports community. I wanted to put that slide in there, and I won't talk about it a lot, but the federal government and the provincial government, as Rob pointed, this is evolving on a daily basis. Actually on an hourly basis, just given what I've seen from the feds this morning. But all the people that, or all the organizations that are listed here on this slide are in some way working on this, and I want to thank each and every one of them because they're doing a phenomenal job, and Peter and Jessica for organizing this meeting as well. Supports for individuals. We know that there's a rental supplement, $300 with no dependents, $400 or $500 with dependents. There's a fairly significant application process provincially that goes along with this, that both the tenant and the landlord has to go. But as I said, you can see the lines here. When you get this presentation, you'll be able to click onto these links and get all the details for that. There's the emergency benefit for workers, that's $1,000, and one of the, if you're on EI or on the CERB program, you can still qualify for that. ICBC deferral payments, you can defer those for almost 3 months in terms of if you're on auto pay. We're working really hard to look at that. Our critic Jazz Johal yesterday got the minister to get a full report coming from ICBC because people just aren't driving as much anymore, and there should be some relief on that. And then disability payments. For those that have some disabilities, you're going to have a $300 a month for 3 months process. Tourism, arts, and culture. This is where I live. I'm the critic, the co-critic of tourism, art, and culture. Virtually nothing has been done on this file. Arts and culture has got some money. I saw from the feds, arts and culture got some money this morning as well. The Premier put together an economic recovery task force, and there wasn't one senior person on that task force from the tourism businesses. So I fired off a letter to the Premier last week, wondering why that was. So hopefully I haven't heard back from him, but tourism obviously is the hardest hit sector in any of the sectors in the province of British Columbia. I've got a call this afternoon with Destination BC, with Marcia and also the Deputy Minister to talk more about this, but it's severe. And one of the things I'm pushing for really hard is in terms of recovery, it's not really going to be a recovery. I don't think it's going to be a rebuild. And what that looks like, we don't know yet. It depends on how long this is going to take. But I definitely am pushing for a rural strategy, just not an overall provincial strategy. So tourism has taken it on the nose. Literally thousands and thousands of jobs have already been lost. Children and youth, I won't spend a lot of time and just to give you some ideas about what's going on, but there's a lot of programs associated with children and youth, a temporary emergency fund. Special needs children are getting $225 a month for 3 months. So there's programs like that out there. Seniors as well, obviously we want to make sure our seniors are well taken care of, and seniors are also going to, even if they are on EI or the CERB program, they'll get another additional $300 a month for the 3 months that we're talking about as well. Mental health and other supports, this is the one that's really keeping me awake at night. They're doing some modeling around this. There's incidents, as we all know, unfortunately, of anxiety, depression that's already starting because of the isolation. Domestic violence and gender-based violence is up, which is just horrible. So this COVID-19 is going to have an enormous effect, I think, on people's mental health, which will also affect the working community. So there's lots of programs around that. I really encourage everybody, if you're having and struggling with that, to go to these resources, and Family Dynamics here in our own valley is doing an outstanding job on that. So lots of programs in terms of COVID-19. We're not out of this. The modeling that I talked about yesterday when I had a meeting with Dr. Bonnie Henry, as I said, we're doing fantastic, but we are nowhere near out of this yet. And we've got to remain vigilant and do all the things we're being asked, because it's working, folks, and that's really important. So I'll just leave it at that for now, and welcome questions.
Thank you very much, Doug. Yeah, I think you just have to unshare your screen there or stop that screen share.
Okay, try to figure that out. There we go.
There we go, and we're back.
Look at me go.
Perfect. So thank you very much for that download of information. I'm sure there's going to be some questions following from that. My colleague here, Jess Fairhart, who oversees the Radium Chamber and Tourism Radium, we'll be both keeping an eye on the question box. And I noticed that Rob Morrison, thank you, you've already answered somebody's questions in there. So the majority of those questions will be answered live, but please, I strongly encourage the attendees. This is a unique window to get as many things. I don't think there's a silly question out there. So please don't hesitate to ask, and let's take advantage of this great time we have with our MP and our MLA. So Jess, if you've had a look at the question box and you want to jump in there with maybe the first question, that would be great.
Perfect. So the first question is from Claire Reinhardt. Some golf courses have announced opening dates and the protocols to follow. As some members are from outside our area, what should our messaging be? And then I'll follow up with the second part of that from Rick. It also says, with all golf courses closed in Alberta, they are being drawn to our valley as we are opening ours. I do not believe this is in our best health interest. So I guess looking for some feedback around golf course openings, operations, and messaging to the public.
Well, I'm happy to take that. I've been working actively on this file, Jessica. I guess I'm going to defer to the Chief Provincial Health Officer, Dr. Bonnie Henry. Dr. Bonnie Henry has made it very clear that golf courses are allowed to be open as long as people are practicing the safe distancing and so on and so forth. I know I've had long conversations with folks here in the valley around our golf courses. The Golf Association of Canada have come up with incredibly detailed protocols, and those protocols have been shared with all the interior health, actually all the health regions in British Columbia, including Dr. Bonnie Henry. So I guess I would have to defer to Bonnie Henry. I know that there's a concern, and everyone knows that I've been fighting really hard to make sure that people are trying to stay in their own homes, as was directed by both the Minister of Health in Alberta and BC. But right now, according to Dr. Bonnie Henry, that is, golf courses can open as long as they're practicing the rules. And that's what I've got to defer to, is her best judgment.
Okay, Rob, anything to add to that?
Yeah, that's I support Doug. If I know our golf courses are opening because we expect people to physical distance, and so I support that wholeheartedly. With Alberta, that is, again, that's a provincial issue, not federal. So yeah, I would like, though, if we can, Jessica, if I can just answer that, the question I asked had already answered. I have a little more information if you want me to expand on that.
Yeah, for sure.
Okay, so the question basically was, what of the 75% for people who maybe either they're seasonal and it's hard for them to show the losses. Now they've changed that to, for period 1, which is March 15th to April 11th, you need to show a reduction of 15%. And it's March 2020 over March 2019, but if you can't do it, then it's on the average of January, February 2020. So if you have a 15% reduction from January, February to March, then you qualify. And for period 2, for April to May, it's a 30% reduction. And again, it's either April 2019 or the average from January, February 2020. So it's more inclusive of not people who are more seasonal. Thanks, Jessica.
And also, Jessica, just back to that golf question, I know it's on top of front of people's minds, is that I know that myself and my offices are continually reassessing this, but it all goes back to the recommendations of Chief Medical Officer Dr. Bonnie Henry. So obviously there's concerns. I do know, having spoken with several of our general managers of our golf courses just here in Columbia River, Revelstoke isn't open yet because they have too much snow still, but the ones here are not necessarily advertising abroad or well, obviously not abroad, but to the other province. It's really focused on locals. So we're going to have to wait and see. I know that one of them opens up next Friday, and a couple have opened already, the smaller ones. So we're going to have to keep a close eye on that.
Thanks so much, Doug.
Sure. And the next question kind of plays into that a little bit, I think, because I think when product is put out there, it's an invitation to utilize that product. So given our relationship with that close border to Calgary or to Alberta, people are going to be a bit stir crazy there and will want to get out on the links over here. So to your point, Doug, we'll just have to see how that goes. But Diana Moore asked a question here. She said, I really want to go to Saskatchewan to visit my parents who are not well, but I am staying put as per government request. I do see a lot of out-of-town plates around with sleds and dirt bikes. Any way to enforce travel restrictions? And I know some provinces and communities have done that, so maybe a lens for our area on that regard.
I can, on the federal side, unless the Emergency Measures Act is enforced or employed, I guess, we will not have military at the borders. It is up, the province themselves can set up road checks and have people, when they come in, ask them if in fact where they're going to is essential for travel. Do they need to go to Invermere, or can they stay home wherever they come from? So really it's right now, every province is taking some different approaches. Back east in Nova Scotia, for example, the province has decided to have the RCMP, for example, just do a road check and talk to people who are coming into Nova Scotia and have them explain why they're going there. And in some cases, they're wanting them to self-quarantine for 14 days if they come from outside.
And just to agree with Rob on that, Section 6 of the Charter, Canadian Charter, guarantees mobility rights. So unless you invoke the Emergency Measures Act, you can't prevent people from doing that. Also, however, setting up these roadblocks that you've seen in other provinces is certainly something that BC has not considered yet. I know that there were others from other provinces in our valley last weekend for the long weekend. But what I can tell you that's on the positive side is that all the reports that I got from mayors and regional directors and even constituents is that those numbers weren't nowhere near what they usually are. So I think that message is starting to resonate. There are people like the caller that you just mentioned, the question. The message that is still predominantly being sent by all chief medical officers is, unless it's essential travel, stay at home.
Yeah, and I'd just say too, I think our province has done a really good job through the leadership of Destination BC. I know the destination marketing organizations are supporting that voice of Explore BC Later. I think it was a really well done campaign, and I know a lot of our businesses are following it and supporting it as well. So just encouraging people to, not do that non-essential travel at this time, and to come and visit our beautiful province, later when the timing is right.
Yeah, and I would just reflect what Jessica said. Destination BC is working really hard on that. And if you have the opportunity to go onto YouTube and search Destination BC, explore BC later, they've come out with just an incredible video that I encourage each of you to watch. It's very short, but it's to the point, and it's something that if you can share that on social media, I certainly would encourage you to do that.
Doug, if that's not in your presentation that we share, maybe Stephen and Rachel, if they're listening, could just add the link for that in the PowerPoint that you shared.
We can actually do that easy, Pete, when we send it to you. Yeah.
Perfect. Jessica, the questions are stacking up, so we'll start a little quicker.
So jumping in. So I have Bailey Yates at the top of the list. Bailey's asking, at what point will it be acceptable to start marketing our valley and businesses once again?
Well, from a provincial perspective, that's I think Destination BC has got a three kind of a pronged approach to this, and right now we're still in quotes from the health perspective, according to Dr. Bonnie Henry, phase 3. So it really is up to the public health officer to decide when things can start opening again, when we can start doing things again. And myself as a MLA and Rob as an MP take direction from those health officers. And until, as does the marketing agencies, until such time as we've been given the green light, that's when that's going to happen. I know that it's not an easy thing to hear, but until the health officer says we're going to start doing these relaxations in these areas, it's going to be interesting to see as of April the 30th. There might be some changes. I don't know that for a fact, but we've got at least a couple of weeks to go before we see anything changing, if at all.
And I'll just tap into that. And what Doug's saying, we totally agree with. I just know that myself personally and my office that's in Cranbrook, most of our calls right now are all related to small businesses pretty well. And I think it's important that we get the message out now, not later, that it's going to be very important to support our local small businesses when we do open the door. And that light, there is a light at the end of the tunnel. And you can tell by the results of COVID-19 that we are getting out of this. And I think it's really important to stay positive and to get that message out that we will be open for business, and hopefully sooner than later. And so we just get that messaging out there.
And just to add to that as well, is that Destination BC is doing a lot of virtual marketing. So they're out there finding out what people are thinking about traveling, and they're also promoting virtual tourism. So that kind of promotion is still going on through Destination BC to try to promote places like the Kootenays. So that is still going on through Destination BC, but it's all virtual to try to keep keep people's interest. From a tourism perspective, in terms of when you can advertise all this as well, you've got to remember that the markets themselves, the long haul market, China and Europe, they're not going to be opening up anytime soon. The short haul markets into the United States and Mexico, the Prime Minister said this morning that there's the opening of these borders are not going to be open anytime soon. So we've really got to focus on domestic markets and local markets, and I think that's what Destinations BC's vision is. But right now, the marketing isn't going on because they're focused on the process from Dr. Bonnie Henry.
Mm-hmm.
Great.
Yeah, there's some really great direction from Destination BC. So if you follow on their website for tourism operators, they have some really great messaging guidance week to week that's updated every Thursday. And happy to share offline any further learnings that I have or Doug has from Destination BC as well.
Yeah. No, they're doing an outstanding job. They really are. Marcia and her crew are doing very well. And as I say, I've got a meeting with her this afternoon, as well as the Deputy Minister. So I've got some hard questions. Jessica actually gave me some questions last night to ask. So we got some of that going on today as well.
Yeah, perfect. So the next question from Wendy Booth. I believe we need to stop using the term Alberta and red plates for our second homeowners. The Chief Medical Officer messaging is for folks to stay at home no matter where it is. All of our second homeowners are from Alberta and they are residents here and choose to have red plates.
Yeah, I thanks, Wendy, because that is a great question for a couple reasons. One, what you're saying there, which is a lot of people live throughout Kootenay, Columbia, have license plates from other provinces, let alone Alberta. So they do know, they do live here. That is their home. The other thing is, you have to remember that the provincial health officer in Alberta has exactly the same recommendations for physical distancing, for sanitation, and for large groups of people. So they're the same rules as we have. We have to remember that. And I think the last thing I want to talk about, and I've had lots of people call me, is when this is over, and it will be, the people we rely on coming here to our communities are a lot of Alberta tourism. So we know we'll get there. We just need to be safe and diligent until we get to the point where we can open up that door.
Yeah, I completely agree with Rob, and it's certainly not just an Alberta issue. We saw that on the island this past weekend, with British Columbians traveling, and British Columbians traveling to Calgary too. I mean, in the Kootenay context here. So we've got to make sure that everybody understands the key message is that if you have a primary home, both of the health ministers, both of the provincial health officers, as Rob has said, have said, stay in your primary homes, do not travel to your secondary homes. That's been very clear. Doesn't matter what province you're from, including British Columbia, don't travel, stay at home.
Yeah, and I think that point was just to not name call and not judge. It's second home residents. It's not Alberta residents. It's not Saskatchewan residents. It's not green plates, blue plates, pink plates, if we have any. And you're right, Rob. I think we have so many examples of people in this community that are here helping the community. I know of a locum doctor who was here from out east, and he's here on a 3-month stint with not BC plates. So I sure hope he isn't being vindicated or approached negatively on the street with things like that.
I think it's a good point, Pete. I've got a neighbor down the road that's been here for over a month, and I maybe have seen him 4 times. So there's a lot of people from other provinces that are hunkered down here just like us. Nothing wrong with that. Zero wrong with that. So that messaging is very important, and I'm glad that question was asked by Wendy.
Great. Lauren Bratt has a 2-part question here, and I think we've touched on half of it with regards to that conversation we just had. Lauren owns a business in Radium Hot Springs, a newer business. Many small businesses and small owner-operated enterprises are not eligible for the government programs. We do not have a payroll of $20,000 or higher, as we don't pay ourselves, and we are not eligible for the $2,000 a month personally because we didn't pay ourselves anything last year. What programs are coming out for small businesses who are locally owned and operated and have had to close their doors, as well as refund all reservations and bookings? Small tourism businesses are going to hurt for months and months to come, even whether all the Alberta bash and shaming, we are going to need to help keep our properties and hopefully someday reopen. So I think that just that question, we've covered the provincial Alberta versus BC part in the last topic, but maybe some on the program side, either from provincial or federal, that might be supporting those ones that are falling through the cracks.
Yeah, on the federal side, thanks, Lauren. That's a great two-part question. One is, yeah, we have to quit bashing the Alberta people for sure. But on the side, as far as getting either some CERB or some other financial benefits from the federal government, they have not addressed this. We have brought this up to them. So anybody who's listening, who's in the same or similar spot as Lauren, if you can email me, rob.morrison@parle.gc.ca. We have 100 files opened up on this exact same question. So we will follow up, and we are through our finance critic in Ottawa, we are hammering the government every day on this exact question, because small businesses are falling through the cracks.
Yeah, I would agree with that, Rob. Provincially, there isn't a lot of relief there yet for small businesses either, especially from a commercial tenancy perspective and their own rents and so on and so forth. But I would suggest strongly that if people are finding themselves in financial straits because of this, which they are, I mean, Radium's just been hammered with the pool closure and everything else, so this just continues to get worse for them. Talk to your financial institutions, talk to people at CBP, because as we know, they do have some programs there as well. But provincially as well, it's something that I know that my caucus is very concerned about. And we have daily caucus calls just about every day, so it's top of mind with everybody.
Great, thank you.
Great. Just going back into our question chat box here. We have a few follow-up just comments and questions regarding golf. You know, some have seen emails inviting groups to book times in the Columbia Valley and Cranbrook. Concern is we've done a great job so far at holding the line. But as Doug has said, there's no way we're out of the woods yet. Are we not increasing our risk level? Follow up to that as well is it necessary travel when people travel from other provinces? Traveling that far for a game of golf or to use the backcountry vehicles would be considered unnecessary travel, would it not? And I'm just going to wrap up anything else that we have regarding golf here.
From my perspective, I've got to defer to Dr. Bonnie Henry. And at this point, she has said that as long as the social distancing is practiced, as long as all of the safety protocols are in place, I can also say that I've had the opportunity to go through the National Golf Association's protocols and the processes that they put in place. They're commendable. I have to say that. They've done a good job. It again speaks to the willingness of others to look at this. So, I mean, again, I have to default to the health officer on that.
Okay. There was a question here from Dana Moore just around the vaccine. Is the vaccine going to be voluntary, and can the no-vax people opt out? I think we're a ways off the vaccine.
Yeah, I as far as federally goes, I haven't heard anyone talking about a mandatory vaccine. I think that would be a discussion for Parliament for sure.
Yeah, and that's certainly a federal issue. I know that any conversations that I've been involved is a vaccine is not something that's just around the corner.
So from John Rouse, I noticed that the Columbia Basin Trust has allocated funds for musical performing artists to apply. Is there any relief for small home-based businesses, which are visual arts or arts and crafts or jewelry, those types of businesses?
Yeah, and there was just an announcement today on that, John. If it's John said somebody's using his name on here, but whoever asked that question, yes, there is some. I'm just trying to review it right now while I'm on the call here, but there's some things that are going to come up for that. Also, Canada Summer Jobs has some relief as well.
Yeah, and whoever did ask the question, if that's John, send us an email on that question as well, and we can follow up with you on that after this is all over.
Wonderful. Rod Turnbull's just talking about some cases in the numbers. So BC has a total of 1,575 cases. Calgary alone has 1,242 as of April 16th. I just came from Invermere, where 60% of the cars at Northvilles were Alberta, and 80% of our homes are full. They are all cottages, not permanent homes. I think it's just I don't see a question in here. I think it's just a general discussion around supporting Dr. Henry and stopping the spread. Rod, if there was a follow-up question in there, maybe just enter it again and we will address it. But I think we've talked about this one a little bit now. I think there was the next one, great division between Alberta's second homeowners and local residents continues. And another comment about Vancouver Island Health has closed all golf courses. Doug, I don't know if you've heard anything on that.
I have not heard from that health authority. I know that in Interior Health in Kelowna, golf courses are open now. There's golf courses open in Kamloops. There's golf courses open in Vancouver. So yeah, I don't know about the Island Health.
Rod's comment did go on to say, Doug, just he mentioned you in the comment. Disappointed that you have not stepped up in support and delayed the opening of golf courses in the valley. I'm not sure if you wanted to respond to that, Rod.
Yeah, I sure do want to respond to that and appreciate the question. It's not for me to step up. If I was to step up, and my opinion in this doesn't really matter. It's what the chief medical officer is saying. She's the one that has the authority right now in the province of British Columbia. So it's her decision, not my decision. And I'm certainly not going to go contrary to Dr. Bonnie Henry, because she's done an outstanding job so far.
Okay, thank you.
So another question coming in from Christine Dubois. In one of these sessions, it was quoted, "It is not a one-size-fits-all approach. However, our local government is taking the advice from provincial health officer, and I feel that our local leaders are following direction from only the provincial health officer, who has to take a one-size-fits-all approach. What about taking a Columbia Valley approach? No matter what is said, I don't think the second homeowners are going to stay home. Many of them, like Doug mentioned, are self-isolating, and he quotes, 'There is nothing wrong with that.' Yet that is not the message they are getting, and they are mad. Why don't our local leaders create guidelines for those that are going to travel regardless and communicate those, and then these locals that feel the need to abuse people will stop. The abuse has to stop, and it has to come from our local leaders, as they have stated." So a few points in there. I guess the one is, how do we have a not one size fits all, but one size fits all communication? And then again, still addressing, working with our second homeowners and creating a good communication strategy with them.
Yeah, I think that's a fair question, Jessica. I certainly can't speak for Dr. Bonnie Henry, nor would I. But I think if you look at where COVID-19 is throughout the province, there are areas that don't have it as bad. I mean, we're doing incredibly well in Columbia River, Revelstoke, and Kootenay, Columbia. I think you might be able to see, and I'm only speculating here, I have no evidence on this speculation, is that in a couple of weeks' time, we may see some changes that are focused more on a region or locally, but that hasn't come through yet. So that would be only pure speculation, and it's not that we're following blindly the recommendations from the health officer. This province has done incredibly well, as I mentioned on the onset of this conversation, compared to other nations. This province is leading North America. So what we're doing is the right thing so far, and we can't let up on that. And that is part of the social distancing and encouraging folks to stay at home and just, it's like Destination BC said, Jess, we're taking a pause from each other for each other. And this isn't forever. It's going to change, but we've got to be kind to each other, and we've got to be supportive of each other. But until, again, the health officer says that it's safe for us to do so, I think we've got to listen to that.
Okay, I'll just to touch a little bit on that. And what's interesting, that's a great question, because more often than not, rural BC or rural Canada gets left out, and one size does not fit all on a lot of things, not just let alone COVID-19. I mean, I fight with the Toronto people when I go to Ottawa, and they don't understand what the Kootenays is all about. So I think it's important that like FCM has talked about looking at issues through a rural lens. So looking at issues that directly affect us and how we monitor those ourselves, and not get hung up with what's happening in the Lower Mainland, for example. So great question, thanks.
I just got the answer to that question. Vancouver Island Health has not closed. The medical officer, so Vancouver Island Health has not closed their golf courses. And it's certainly not up to the MLA to decide, whether a provincial health order is good or bad.
Perfect. If I may, Jess, could you just scroll through the box? We've got about 15 minutes left here, so I would encourage the attendees to put in some final questions so that we can try to get through as many of the questions as we possibly can. We're going to wrap up around 12:30 today because our guests have other commitments. So Jess, if you could just see if there's any common themes for the rest of the questions. I'm going to take the question to maybe Doug on the first one here from Jocelyn. And then Doug and Rob, maybe just a 3 or 4 minute wrap up time for each of you at the end, I think, for some closing comments, if that works.
Sure.
Perfect. So it came up on our call yesterday with the DOI, District of Mayor. So we were on a call yesterday, and we learned that business property taxes will be deferred to September, but not without the 10% late penalty. Is there any way this mandatory 10% could be waived by the provincial government? And what we heard from the DOI was that it's in the, I believe it's in the municipal bylaws and constitution in terms of, it's a very difficult thing to change. The only flexibility that the municipality has is to spread that 10% penalty out maybe in 2 installments. But do you have any knowledge of that, Doug, in that in that
No,
level?
I don't. I couldn't comment on that, but whoever asked that question, please have them send me the email and we'll follow up on it.
Yeah, that's Jocelyn Bonner from Summit Footwear in Invermere.
Jocelyn, yeah.
And Rob, I don't know if you have any insights into business property taxes for municipalities from a federal level. I don't know if it goes that far.
No, it doesn't. I mean, in my closing, I'm going to talk about a couple things for businesses, but no.
Okay, great, thank you.
Scrolling through here, another area from John Rose is have we mentioned the extent or level of testing in the area? So how much testing is happening in our region, and what extent, to what extent?
Well, from a provincial perspective, we're from what I understand is that testing is relatively going well throughout BC, but people who are not showing symptoms are not being tested. From what I understand, I think Dr. Mannheimer, who's our chief of staff here, would be better able to answer that question. But again, from that individual who just asked that question, please email that to us and we'll have a follow-up for you.
Great, and Susan just mentioned, for those of you that may or may not have seen it, there are really critical surveys, database surveys that are going on in our area. One right now is from StatsCan. It's a national survey in conjunction with the Canadian Chamber and the Canadian government. And if we get enough responses from our region, we will be able to break out some quality data from that. And then also the BC Chamber has the BC Mind Reader platform, and we are in the 3rd survey since COVID has started. And again, really critical that we can get as many people filling out those surveys. I know there's a lot of information out there, but I would encourage people to sign up for the newsletters that group that Doug mentioned earlier. We're creating 3 newsletters a week, Mondays, Wednesdays, and Fridays. You can sign up at cbchamber.ca. Anybody can sign up. You don't have to be a chamber member. And we generally communicate those links out through that medium. So if we get enough participation, having that key data, and Jess can touch on it as well because she has the lens through the Destination BC and how they're using it. It just positions us into a really strong place for recovery when we can speak confidently to the impacts financially and from a data perspective for our region. And maybe just add a comment on that.
Yeah, I would just reiterate what Pete has said. The data from these surveys, especially the BC Mind Reader survey, is really, really important. There is a partnership between the BC Chamber of Commerce and Destination BC, and data is being pulled specifically for the tourism and hospitality industry, and that is being used by Destination BC to advocate through the ministry and to develop programs and supports for the tourism industry. So we've seen really, really great engagement from our region. I think we've had at least always a minimum so we can pull community specific data. So encouraging our business owners to continue to engage with us with our surveys. And thanks for your valuable input. It is informing policy and it is supporting decisions that are getting made.
Just also just to jump back really quickly to that testing question. For people who meet the criteria as Interior Health has opened up referral-only screening clinics across Interior Health region, which actually includes Cranbrook. But there's also, and I failed to mention that, there is an online tool that's really important that if you're not feeling well, to go onto that online tool and do a self-assessment because it's very specific. And people have been using that too. So if you're concerned about being tested or having something, if you don't feel well, stay at home and take that self-assessment tool. And I think it's really important, and I've heard that from the docs in our region, is that one of the things that just because of COVID-19 doesn't mean that all other medical issues stop. If you're not feeling well for any reason, make sure you're reaching out to your doctors and make sure that your general health is well maintained too. So they don't want people to say, oh, well, I don't think I've got COVID-19, but I've got a pain in my chest and I'll just ignore it. Don't do that.
That sounds good. And I guess that follows up to one of the last questions in our chat box. BC residents weren't able to be referred to Calgary Healthcare in the areas of specialty and subspecialty medical advice, yet Calgary friends of mine are offered are offended over comments by me and Morrison Valley. How can we better communicate about our issue with minimal capacity in Invermere and Cranbrook hospitals?
Yeah, I'll start with that. I know Doug will finish this off because we were on the same page with this, but we have been working hard with Alberta to open up the medical facilities in Calgary, for example, for residents from Invermere, Golden, and Revelstoke, and also through Cranbrook and Creston, just because that is where a lot of our support networks are in Alberta, because a lot of people who live in this area come from Alberta. So we are trying to work to open that up, because under the Canada Health Act, you are entitled to healthcare, and it's not province specific. So I do believe there's some billing issues, but it is not insurmountable. And we were working on that until COVID hit. And that's, of course, slowed down Parliament. But I was having some meetings set up in Alberta to work with the Alberta Provincial Government and also the BC government to try and iron out why it's so difficult for us to go to Calgary or anywhere in Alberta to get some medical assistance. The second part of that question as to our capacity, yeah, I think that is out there. That is, again, provincial, but it is important to remember our hospitals have nowhere near the capacity that the cities do. So it is important to know if they're coming here, we are limited in what we can do.
Yeah, I agree with Rob on that too. And for those of you who know, or maybe you don't know, Rob and I have worked on this thing together, and I've been working personally on this for the last year and a half, if not 2 years. And I've had conversations directly, one-on-one with the Alberta Minister, Tyler Shandro, on this. I've met with Adrian Dix, our health minister, 3 times on this in Victoria. I think what you're starting to see is that there's still people that are being referred to Alberta, and they certainly are being accepted, but there's a lot that are not. And it's a huge issue, and we're trying to address that. It's to some extent, it is a capacity issue in Alberta. They're having difficulties serving, Albertans. But to Rob's point, we're all Canadians, and so it's something that we're both working really, really hard on. There's a lot of balls in the air on this one, but the minister himself in Alberta is aware of this. Now, of course, with COVID-19, it's kind of, to Rob's point, it might be a bit on the back burner, but it's something that both of our offices, both of us are working on, and hard.
Great. One last question from the chat room or the question box before we close that down. And I would just encourage any attendees. I'm sure both Doug and Rob would welcome any questions directly to their office via email or call or otherwise. So if you didn't feel like you had your question answered fully today, or if you didn't get a chance to ask something that you wanted to, by all means, reach out to them. I'm sure they'll be happy to hear from you. So the last question before we close off the question time is, why can't we get information directly from Interior Health? Do they think we cannot handle the knowledge?
Okay, you're good. I think it was Rick and Pete, I guess. That is a great question. I asked that question. I do not agree that Interior Health does not give us the results or tell us where we have positive COVID. I'm not asking for a name. I'm not asking for a street address. I'm only asking for a community, which is exactly the same as everywhere else in Canada. So yeah, I think we should have it. I do not agree with the provincial government on that, and I did bring that right directly to the provincial government, and they would not allow me to know what regions have some people who are COVID positive. I don't think people are going to run scared. I think people know that COVID does not have any borders. It can go anywhere, but I think people have a right to know if there are some people who are infected in their communities.
Yeah, I would mirror that as well. I know that Interior Health is holding town hall meetings regularly, and hopefully there's more to come on that. They've had their reasons, and certainly I don't particularly think that there's any downside to knowing. But at this point, to Rob's point, they haven't been able to do that.
That's great. Thanks so much for that. I think that kind of concludes our question period from our viewers today. So thank you everyone for sharing your great questions, and thank you to Doug and Rob for all the answers. And I'm sure you'll be seeing some follow-up from this group in the days to come. So I'd just like to invite you both to kind of put together or share some closing thoughts, wrap up other information that businesses and residents in the Columbia Valley should know during this time.
Okay, I guess that's my cue, Doug. Yeah, no, thank you so much for everybody who called in today. It was, it's nice to be able to do this. We'll do this often. It's nice to hear the issues, concerns. As Peter said, we encourage you to send emails to our offices. It's a lot easier for us to work on a file and track it, especially something that's complex and we're asking questions through Ottawa, which takes a little while to get an answer. But a couple of things that we've done in the last little while is I've asked the finance minister to have an exemption for RRSP people of something like a $2,500 a month, non-taxable, to help, especially to help some of us. Maybe we want to help our children who are maybe unemployed and struggling financially. So if we can take out a little bit of money out of our RSPs without penalty, we could help them or small businesses. So I've got that in the queue. And also, a question didn't come up, but I was working on it this morning, is the credit unions were not included in the big banks on the original onslaught of helping businesses out. That tells you how narrow-minded it is in Ottawa. And of course, most of the people here in our riding use credit unions. So we've got that on track. Credit unions within the next couple of days will be able to help out with the business loans. So we're working on that. And as we talked earlier, it is a daily changing times we're in. So I encourage you to go to my website, which is robmorrisonmp.ca, or call or just send an email to us, and we'll help you get through some of the challenges that you have. And again, thanks for having me on today, and I really appreciate it. And I hope everyone has a great day. Stay positive, because things are looking better. Today, for one of the first times, one of the media said something positive, and that was we've had the lowest number of new cases in British Columbia. A positive thing that I haven't seen too many positive news reports from CBC Global. It's almost depressing. So it was nice to see something positive for a change. Let's keep doing what we're doing. Let's get these businesses open as soon as we can, so we can get to somewhat to normal. Thanks again.
And I would mirror what Rob says too. I want to thank you and Jessica, Peter, for putting this on. I think it's really important, and it's a great medium through which we can reach out to people and get some of those answers. And I encourage everybody, if you want the presentation, we will be sharing it with Peter, and it will provide direct links to those areas that I talked about, live links, and those links are updated on an almost daily basis from the government of British Columbia. Some great questions today, and I think that you know, we appreciate what's going on. And as an MLA here, I understand some of the frustrations. But know that I think the measures that we've had, it's working in British Columbia. As I mentioned, the modeling that I saw yesterday with the meeting that I had with Dr. Bonnie Henry, and I wasn't the only one on the call, obviously, but we're doing a phenomenal job. And I just really want to thank everybody for doing that. And as far as people from out of province traveling or in province, because I've received emails from people that are from Revelstoke who have got a place out here on one of our lakes and said they're not coming here for those reasons. And my neighbors down the road haven't been here for 5 weeks, and we're checking their house for insurance purposes. So I think the message is getting there. There's no question that there are those that are still coming. I know that we've been very grateful and thanking people for listening to both of those health officers. So stay safe, stay healthy, you know, self-distance. This isn't forever, but it is for now. So let's just keep doing what we're doing because it's working. And please don't hesitate to reach out to our offices. Both my offices in Revelstoke and Kimberley are physically closed, but we're on our email every day. We're on our phones every day. I have the absolute privilege of having 2 interns working directly with us right now. One is right from here in the valley, who lives, his parents live in the valley, and he's from the valley. the other one's in Victoria. So we've got some resources that we can utilize. If you've got those questions, please don't hesitate to reach out.
Fantastic. And just maybe to your comment, Rob, about doing this again, given the changing landscape, perhaps we could commit maybe 2 weeks from now, maybe would be a good time to reconnect and offer this type of a session again. Would that work?
That'd be perfect. Absolutely.
And Doug, would that be something?
No, we're good.
Yeah, perfect. So for all the attendees, we will, Jess and I will work on that, and we'll find a time, and perhaps we'll find a way to do a survey in advance of that to see what the real topics are that we can lead off, and then perhaps Rob and Doug can lead with some topics in their opening comments for the next round. So
and also, Peter, just to say, anybody who had any direct questions that wanted to talk about this even more, happy to give me a call or send me an email. I'm happy to talk about it.
Fantastic. Well, on behalf of Jess and myself, Doug and Rob, thank you so very much for flying the flag for our region and for making the time to connect with us today. This was, we recorded this session, and as soon as we can figure out the technology to get it up in a link, that'll be another way that people can share and see what was brought up today. So with that, thank you so much, everybody. I'm going to end the meeting, and we'll connect with you all again really soon.
Okay, thanks very much. Thanks, Justin. Thank you.
Thanks, everyone.